We'll be getting started shortly. Please share your name and where you are joining us from in the chat box. Welcome everyone, and thank you for joining today's webinar, Competency in Focus Evaluation. My name is Abby Nellis, and I am a Senior Associate with CADCA's Public Health Programs team. CADCA, in partnership with the Center for Public Health System Science at Washington University in St. Louis, is excited to present today's webinar, which is the second webinar in our 18-part webinar series on CADCA's core competencies for coalitions. Next slide. Before we dive in, I just want to do a quick overview of CADCA. Using a community-led approach, CADCA is dedicated to empowering coalitions and health departments across the globe with the tools, expertise, and support needed to drive positive change in their communities. Through top-tier training services and an evidence-informed technical assistance system, we help build your capacity to implement best practices that improve your community health outcomes. To explore more about our work and subscribe to our weekly newsletter, visit cadca.org. Next slide. I'm sure we are all familiar with Zoom by now, but I'd like to go over a few housekeeping notes. All participants are muted by default, so for general comments, please use the chat box. We will have a Q&A portion at the end of the presentation, so for any specific questions for the presenters, please use the Q&A box. You will receive a post-webinar email with the recording of the webinar, slides, and an evaluation survey. We kindly ask you to fill out the survey. Letters of attendance are given only upon completion of the evaluation survey. Next slide. And now I'd like to introduce our presenters. Today's webinar will be led by our valued partner, Katie Windeman from the Center for Public Health System Science at Washington University in St. Louis. Katie is a senior research assistant at CPHSS and contributes to several dissemination and implementation science projects. Before joining CPHSS in 2023, she earned her Master of Social Work degree from Washington University in St. Louis. We are also joined by Andrea, a senior analyst on CADCA's evaluation and research team, where she leads the organization's training evaluations and supports multiple coalitions in assessing the impact of their prevention efforts through CADCA's coalition evaluation services. She holds a Master of Public Health and Epidemiology from George Mason University and brings expertise in mixed methods research and community-based evaluation. Next slide. Our panel and the second part of this webinar will consist of Jessica Price, Jaden Adams, Teresha Friedman, and Madeline Drapp. Jessica Price is the Evaluation Manager at CPHSS and oversees evaluation and implementation science projects including CADCA tools and manuals, Reach St. Louis, and the Rural Communities Opioid Response Program. Jaden Adams, is the Director of Behavioral Health at Prevent Ed, where she oversees adult assessments and referrals, an early intervention youth program, Guide Ed, and a growing team of certified peer specialists. Teresha Friedman is the Associate Director of Certified Peer Specialists at Prevent Ed. She leads efforts to empower peers through shared experiences, fostering a supportive environment for personal growth and recovery. Maddie Draff has been serving as a public health educator at the Lincoln County Health Department since April 2021. Her primary focus is on maternal and child health, with the responsibilities that span a range of initiatives including suicide prevention programs in middle and high schools, as well as child safety education. As you can see, we have quite the group with us today, so thank you all for joining us. And Katie, I will pass it on to you.
All right, thank you, Abby. So I'll get started by sharing our goals for today. So first, I'll briefly review the background and purpose of CADCA's coalition competencies and introduce the evaluation competency. Then you'll hear from our panelists about their evaluation experiences through a Missouri-based example. And finally, we'll conclude with ways you can get evaluation support at CADCA. Next slide. So CADCA's coalition competencies are all based on research, and they're designed to help coalitions be successful and make an impact on their community. Next slide. There's 18 coalition competencies that are broken into 3 domains of operations, community, and prevention. Next slide. The coalition competencies were developed through a 4-step process based on best practices and competency development from the Federal Employment and Training Administration. It started with a process of gathering background information from over 200 articles and expert interviews with coalition leaders in the United States and around the world. This was used to then develop a draft model, which went through a feedback process with CADCA staff, trainers, and coalition members. And that resulted in a final refined model that we are excited to share with you today. Next slide. So this presentation of competencies in focus will focus on the evaluation competency. This webinar series is walking through one competency at a time. Last month we did sustainability, and this month is all about evaluation. Our competencies are substantial and important, so it's really exciting to have this time to focus on each one in depth. Next slide. Evaluation falls under the prevention domain, which also includes competencies like assessment, implementation, and policy. Next slide. And today's competency in focus is evaluation. So here you'll see the competency page, which includes a definition of the competency at the top, as well as some evidence from the literature about why evaluation is an important competency for coalition success. And then finally, it breaks down the knowledge, skills, and abilities that are helpful for coalitions and coalition members to know to successfully lead evaluation. These pages are designed to be accessible and easy to use, and so we hope that they can be meaningful in your coalition's work. Next slide. So we'll begin diving into evaluation now. You might already have an idea of what evaluation means, but just to get us on the same page, we'll share our definition. Next slide. Evaluation is systematically collecting, analyzing, and using data to examine the effectiveness and efficiency of the coalition and contribute to continuous program improvement. Next slide. So why is evaluation important for your coalition? Next slide, thank you. So from the evidence and from the research, we found that evaluation facilitates effective decision-making, problem-solving, and improvement in coalitions. Evaluation also helps you determine your priorities and make changes over time, and it contributes to coalition sustainability and improves accountability. Next slide. So now we'll go into the knowledge, skills, and abilities that all fall under the evaluation competency. So starting with knowledge, what kinds of things does your coalition need to know? We have coalition background or knowledge about your coalition's evaluation history, goals, and capacity. There's also knowledge about evaluation methods and design, evaluation analysis knowledge, or how to use descriptive and inferential evaluation results to analyze coalition efforts, and knowledge of dissemination to help you communicate your results in a clear and effective way. Next slide. Next, we have the evaluation skills. So these include things like team expertise, evaluation planning, goal setting, data collection, data interpretation, and communication. Next slide. And the evaluation abilities include evaluation tools, or the ability to use a logic model and other data collection tools to evaluate your coalition's functioning. There's strategic planning, which is the ability to assess short and long-term outcomes and use evaluation findings to adapt coalition activity. Partner engagement is the ability to engage community partners and decision makers throughout your evaluation process. And finally, integration, or the ability to embed evaluation and monitoring into your coalition activities. Next slide. And so with that, I'll pass it to Maddie to share some of her examples from the field.
All right, thank you. You can go ahead and go forward to the next slide. Okay, so I'm here to kind of provide a little bit of a background of a coalition called Lincoln County CORE, which stands for Lincoln County Community Opioid Response Efforts. But first, I wanted to share a little bit of background of Lincoln County specifically. So, Lincoln County is a rapidly growing rural community located in the eastern part of the state, approximately 40 miles north of St. Louis. As of 2023, the county's population is estimated to be around 64,000 people, which was about a 9% increase since the 2020 census. So we're rapidly growing, but we do still have a very rural presence. As the history of CORE, CORE was developed in or established in 2019 to create a collaborative response to the opioid crisis affecting Lincoln County. Founding members include key partners from healthcare, mental health services, first responders, treatment professionals, community organizations, and community members. But following the COVID-19 pandemic, like so many others, LC Core faced the challenge of rebuilding our momentum and re-engaging our coalition and our partners. So since then, much of our work has been stalled, or much of our work was stalled during the pandemic. But since then, we have responded by focusing on community outreach and working to make CORE a visible and recognizable presence throughout our county. We have done that by launching awareness campaigns, billboards, and actively expanding our coalition's reach. Lincoln County Core's mission centers on providing resources, advocacy, and overdose prevention. And through that, one of our key projects has been developing a local resource guide, which is tailored to law enforcement and EMS professionals. And they distribute those during applicable calls and when providing Narcan. We also regularly attend community events to educate the public and distribute harm reduction tools. Our coalition meets monthly and we share insights, review data, and discuss what members are encountering in their daily work. These meetings are critical for identifying trends, challenges, and actionable solutions to reduce and prevent opioid misuse in our community moving forward. So that is a little bit of background of what our coalition is, what our mission and our goals are. So with that, I will pass the mic over to Jaden.
Thank you. Hello, everyone. So I'm Jaden Adams. I'm the Director of Behavioral Health at Prevent Ed. So Prevent Ed is a nonprofit organization. We've been around since 1965, and we cover a 7-county region around St. Louis. So the more funding we've received, the further we've kind of grown. I remember when we got funding for Lincoln County, a lot of people were like, where is that? So we have expanded to a lot of rural locations. So what we do here at Prevent Ed, we provide substance use assessments and referrals. So we're not a treatment center, but we can definitely connect people to treatment. So we typically get people who are maybe on probation or parole, or maybe they are referred through their employer. We do an initial substance use assessment and then just determine kind of what the next steps would be for that individual, whether it's treatment, inpatient, outpatient, maybe attending self-help meetings, whatever that might look like. We also have an early intervention program for youth called Guided. So that is when a student maybe gets caught at school with a substance, they can be referred to us, and we do an assessment with the student and their caregiver. And we provide educational workshops for that student, just educating them on what they're putting in their body and how that's affecting them. We also have a rapidly growing team of peer support specialists, and they are individuals who have lived experience with substance use. So they are wonderful to work with because they have that unique experience themselves, so they can help walk other people who are maybe in active addiction find recovery. We also have a team, we call it PRC, where they go out in the community and they help form community coalitions, which is how we're involved with CORE. We have different team members at Prevent Ed that attend those monthly meetings. And so we've got community coalitions in all 7 of those regions surrounding St. Louis. We also do a lot of community presentations and trainings. We do overdose prevention trainings, naloxone trainings, and we also distribute Narcan. We have a Narcan vending machine. We have a lot in Lincoln County now as well, which is really great, spread all across the county. We give out things like medication disposal bags and just educate people on how to be safe with their medicine and their substances. And then we have a huge team of educators who provide school-based prevention. So they go into schools all the way from kindergarten to 12th grade. Kindergarten through about 5th grade is more focused on character development and just kind of developing those skills. And then from 6th to 12th grade, we teach about specific substances. So that's kind of Prevent Ed in a nutshell. We do quite a bit. But in 2022, we can go to the next slide, Jessica. Thank you. In 2022, we received a grant specifically we wrote it for Lincoln County. It's through the Health Resources and Services Administration, and it's an RCORE implementation grant. RCORE stands for Rural Communities Opioid Response Program. I had to write that down or else I would forget it. But the RCORE implementation grant, it's actually ending this year. It was a 3-year grant. But the objectives that we wrote into it were increasing recovery support services through hiring certified peer specialists in Lincoln County. And we were able to receive enough funding to hire 2 certified peer specialists. Another objective was to reduce stigma attached to having substance use disorders by increasing public awareness, which we'll talk a little bit about later. Increased training and education of staff, community members, first responders, and then increased training and education of providers as well. So along with a survey that we'll talk about a little bit later, we've also held focus groups every year with first responders, service providers, and community members, just to kind of get the lay of the land when it comes to working with people who use opioids. So that is how all of this got started and how we were able to work with this awesome evaluation team. So with that, I will turn it over to Jessica.
Thanks, Jaden and Maddie. If you have been closely following all of the exciting things coming out of CADCA related to the competencies, then you may have seen me before talking about the work that our center does in dissemination and implementation science and research translation. We also do evaluation. And one of the groups that we have the absolute privilege of working with is the Lincoln County Core Coalition and with Prevent Ed. And we're very excited to walk through an example of community engaged evaluation today. We've set the stage of, who is the community, who are some of the key actors, and now we're going to talk about our specific example of some things that we learned from engaging in community-based evaluation. So as Katie already went over, each competency is made up of the key knowledge, skills, and abilities that research demonstrates are essential for coalition success. And I wanted to particularly pull out 2 of the abilities under evaluation because they particularly relate to our example today. So strategic planning, assessing outcomes, using findings to adapt coalition activity, and then partner engagement, being able to engage with community partners, community decision makers throughout the evaluation process to plan, to collect data, to analyze, to communicate results. So keep those in mind as we walk through our example. So Jaden went over the goals of the grant that we've been working under the past few years. And an important part of identifying the impact of the work on achieving those goals is understanding how are people in the community, specifically people who are interacting with people who use opioids, so medical providers, behavioral health providers, first responders, how are they perceiving people who use opioids? How are they perceiving their own skills and abilities, their own competence, right, in providing treatment to people? How do they feel about their level of knowledge? How do they feel about the openness that they feel from people who use opioids to their services? So we conduct a survey about every year. It ends up being a little more than once a year, with medical providers, behavioral health providers, and first responders to get at those questions. We do this through an online platform. We use Qualtrics, and we use a snowball approach to sample recruitment. We at WashU, we are neighbors to Troy and to Lincoln County, but we are not right in the community. And so we use a strategy that helps to be more closely connected to the people who are being invited to participate, by working with Jaden to connect with people who are in the community, who are leaders in their organizations as first responders, as medical providers, who then help get us in touch with others who can take the survey. We do carefully track all of this recruitment. There's multiple ways to do a snowball sample. You don't have to track it. The benefit for us of tracking it is that we're able to calculate a response rate. We can look at, okay, out of how many people were invited, how many ended up taking the survey. So we do track all of this, but we really rely on community engagement for the data collection itself, bringing people into the survey, making them aware of it. We would not have the success that we have had if we were trying to do a cold outreach to people, inviting them to do this survey. So bringing people in, having various coalition members be that point person who reaches out and invites others who are eligible to participate has played a really, really important role in the success of just getting any sort of data to analyze and respond to in the first place. Then our team will do some early analysis. And the purpose of this, of course, is there's a traditional purpose behind it where we're responding to our funder, we're collecting data to put into a report to share. But for us, the philosophy that we approach evaluation with is that we're preparing for conversation with the partners who are engaged in this work. We are preparing some preliminary analysis. We are preparing some starting points for us to converse and to go through a process of analysis and interpretation together. So I've got just a couple of samples of findings from a wave of this survey. So this question asked, do you agree that it is rewarding to work with people who use opioids? And we see a little bit of a pattern emerging that first responders are less likely to agree that it is rewarding to work with people who use opioids. In another finding, we see that across levels of experience, about half of providers feel like there's not much they can do to help people who use opioids, and that feeling gets worse the more experience that you have. So we prepared all of this, and as an external evaluator, there's a certain amount of value that we can bringing an outside perspective, but we also have to really recognize the limitations of that outside perspective, that we don't know the dynamics of the community, the history of the community, the day-to-day interactions in the community that people who are working and living there have. And so we recognize that we can bring certain skills and resources, but also having the perspective that it's truly one piece in a very complex puzzle that we are bringing. So what we like to do when we are ready to share back a round of data collection and prepare for a co-interpretation process is we prepare for a data walk, which many of you perhaps have hopefully participated in something like this. We print posters that have graphs like the ones you saw, have some key takeaways, things that really stood out to us as being meaningful, or especially if it's something that has changed over time, because again, we're tracking this over time. And as we're seeing changes over time, we might really highlight that. But then that is the moment for conversation to start. So we attend one of the meetings that CORE has. We really appreciate their openness to bring us in as partners and work with us at those meetings. We enjoy attending those meetings. But when we have findings to share, they really give us a lot of space and time to bring this back to the community. So we will post posters around the room. We will tape them up around the room. We will give everybody markers and Post-it notes and handouts with summaries of the findings. And then we ask some questions to get people started. We ask questions like, how do these findings compare to your experience? What surprises you? What doesn't surprise you? And then we have people work through the room in groups or individually, and we encourage them to mark up the posters, to add Post-it notes, to ask questions, to cross things out, to agree, to disagree. Sometimes people will use exclamation marks to indicate that they're like, yes, this is important, and question marks to be like, I don't quite know what this is about, because it doesn't maybe match my experience. And so it becomes a very active, engaging process. The hardest part about it is having to cut people off, because we do try to get people to move through the whole room. And the conversations get so good. You'll have 4 people standing around a poster, reflecting on the findings that are included there. That's the hardest part of the process, is having to be like, okay, take a pause, and we're gonna move everybody over to a new spot. But what this does is it really helps to have people who are in the community, who have the knowledge, the experience, the relationships, to see the data that's being collected and contribute to the process of interpreting it. What does this mean? And what does it mean for our planning and for our future? Which is, circles back to where we began of this competency, is that evaluation should be for adaptation, because we're always changing. Maddie also referred to that in talking about, coming out of COVID and all of the changes that they had to make. Evaluation can be an excellent tool for figuring out what are the ways in which you're going to adapt. So I'm going to pass it back to Jaden, because Prevent Ed is a really key partner in these conversations, because they are such a link in the community. They help to guide this process. So Jaden, back over to you.
Absolutely. Yes, we are the Prevention Resource Center for Lincoln County Poor. And so that's how we're so closely involved. But yeah, the data walk was really great. It generated a lot of good conversation. I know Jessica had sent me the results beforehand, and I can see that on paper, which is really helpful. But I don't live in Lincoln County or specifically work there full time. So I can't develop much of a story just from that. So it's nice to get information from people who live and work in the community. And so it generated a lot of great conversation. And I'll go to the next slide, Jessica. Thank you. So from our conversations, we looked at those stats that Jessica showed, and it really showed that first responders were not happy working with people who use opioids, or they didn't find it rewarding. And so the first question was, why? Why might that be the case? And that's why it's really important that we have everybody at the table when it comes to community members, partnerships, because the Lincoln County Ambulance District is a part of CORE. And so they had representation there who, gave us examples of, well, imagine if a first responder has to go to the same address 3 different times that month and give somebody Narcan, and how frustrating that can be for that person when they're trying to help this individual, but it just continues happening. And so what we thought right away was, they need more, we just need to do a training. They need more training. They need to understand that substance use disorder is a disease. It's not a choice. And this is why it progresses. This is why somebody doesn't have control. This is why somebody might have to, overdose many times before they reach recovery. That's immediately where we went to was, we'll just do a training about it. But that representation of the Lincoln County Ambulance District was able to let us know that they already feel oversaturated with training, and that maybe another training is not the answer right now. But we also talked about the power of lived experience and how our certified peer specialists are in recovery from a substance use disorder. And so they can, again, kind of give that unique perspective. And so they do a lot of presentations where they're sharing their own story. And so we came up with the solution that that may be a better way to go rather than somebody who has a degree on addiction sciences going in there talking about substance use disorder being a brain disease. Rather than that, have somebody who has been through it themselves, who are able to give that lived experience information to them. But even though we decided on, that would be the best route, we also decided let's pause right now. They just took the survey. They've already said that they're oversaturated with training right now. Let's take a pause and we will schedule that for a future training. So that really came out of it. And then looking at the second stat, I talked about how a lot of providers felt like they couldn't do much for people who used opioids. And so we realized that there's this big need for everyone to be knowledgeable of the available resources in the community. So if a medical provider is working with someone who's using opioids, do they even know that we have certified peer specialists in Lincoln County? Do they even know who certified peer specialists are, what they do? Do they know that there's Narcan vending machines available in the community? So just making people, providers, and community members aware of what is out there in the community. And we also noticed that information about harm reduction would be really important for, again, providers and community members. Because if they feel like there's nothing they can do, they might be feeling like they can't stop this person from continuing to use opioids. But there's a lot of harm reduction conversations that can be had. If a provider's working with somebody who's using opioids 3 times a day, have they talked to them about maybe lowering that to twice a day, right? That's harm reduction. If they're working with somebody who is injecting opioids, have they talked to them about changing their route of administration to safer use? Have they even talked about what safer use is, not using alone? There's a national hotline called Never Use Alone. Are people aware of that? So just trying to get providers to have more of these harm reduction conversations with people. That way it's not just solely on if that person reaches a certified peer specialist. That way they're getting this information from multiple people, first responders, medical providers, community members who are aware of this information. It's just important that people know what harm reduction is and how to have those conversations with people, because even if it only feels like a little success, that can make that experience working with that person just that much more rewarding, and they could feel like, they are doing something to help somebody with opioid use disorder, even if it's not making them quit completely, right? Because sometimes, again, it takes time for somebody to maybe make that choice of they want treatment, they want help. It's just keeping that person alive until we can get them that help. So from that data walk, we kind of made a plan of, okay, what is needed in the community? And then now we can actually, set up those different trainings and things like that. So it was just important that we had that data, and then we also were able to come together as a group with community members and providers at the table to where we could get everybody's input of, okay, this is what we're seeing, but why? And now that we know the why, what can we do to address that? What can we do to improve the situation? So it's been really interesting over the years. Like I said, this is our last year in the grant. It's been really interesting to see kind of how those trends have changed over time and how the perception, the negative stigma has gone down, which is great to see. So I think with that, I am going to go ahead and turn it over to Tarisha.
Hey everyone, my name is Trisha, and I have the pleasure of leading peer specialist at Prevent Ed. And I wanted to reflect a little bit. I started in 2020, where we received our first grant, our corp grant, as we're talking about today, in our Franklin County area. So it's a rural area as Lincoln County. It's one of our bordering counties. And so I've had the opportunity for the past 5 years to participate in this in different ways, right? And unfortunately, when we started our Franklin County program, quickly became the height of the pandemic. So when we were, processing this information as we did in Lincoln County, we didn't have the opportunity for a data walk. So you can just imagine my excitement when I was in that meeting and I was like, oh my gosh, this is super cool, right? So in Franklin County, we were able to do, emails and one pagers and things like that, which was amazing. But the data walk, allowing space for reflection and input has really been a game changer. So we have 2 full-time certified peer specialists in Lincoln County. And being a part of that data walk in those conversations, as Jaden was speaking on, really has helped build relationships with our partners. Speaking on one of the big things that we had conversation that day was on, burnout for first responders, as Jaden had talked about, and how can we help with that? So we went to the side and, and talked about how can peers come in and talk to the first responders when they're ready, right? And with all that conversation, I wanted to share that just right before I got on here, one of my peers reached out from Lincoln County to let me know that she partnered with someone from the ambulance today to make it possible for someone to get to treatment. So it's like those lasting relationships, the strong work that was done. I think a lot of that came out of just having those really good conversations during the data walk. If there was 2 things I had to take away from that, that I would do different, take pictures, right? Because we didn't have any pictures of the data walk, and we really should. And as Jessica had said, given more time for that meeting, because the conversation was absolutely amazing and probably could have gone on for another hour. So those are my takeaways, and I just wanted to kind of compare and tell you that I've been on both sides, and the data walk was amazing and has really helped break down the stigma, but has really helped to build some pretty strong relationships that I think will keep going even after this grant has completed. So thanks for the space, and I'll pass it on to Andrea.
All right, hi. So I'm a senior analyst for the evaluation and research team at CADCA. I'm just gonna, wonderful presentations to the panelists. I'm just here to briefly highlight the various resources CADCA offers to support coalition growth and organization growth. So at CADCA, we know that the evaluation isn't just about tracking numbers, it's about systematically collecting, analyzing, and using data to understand what's working, what needs adjustment, and how to improve overall organization effectiveness and efficiency, right? So we see evaluation as a continuous process, one that strengthens everything from strategic planning to stakeholder engagement. So if you've ever attended our National Leadership Forum or a Mid-Year Training Institute, we have one in Nashville this year. If you've participated or are going to participate, we are likely going to have evaluation sessions from CADCA staff, but also we do a call for proposals where we get people from all around the country to discuss their programs like today and their evaluation processes. So our CADCA staff also provides different presentations on qualitative methods, quantitative methods, how to build strong evaluation and communication plans, and how to connect those plans to strategic goals. So we also offer one-on-one technical assistance at these trainings. And then we also have our National Coalition Academy. And so evaluation is woven throughout that curriculum. Our trainers bring real-world experience in planning, data collection, analysis, and dissemination, and help coalitions embed evaluation into their everyday activities. And so lastly, for coalitions who want more customized support, CADCA also has our coalition evaluation services. We partner with coalitions across the country as well to implement appropriate data collection methods. We conduct focus groups, interviews, and even deliver specific trainings regarding evaluation. So we interpret data, we support analysis, and communicate findings in clear and useful ways to stakeholders as well as the organization. So no matter where you are in your evaluation journey, whether you're new or refining your existing efforts, CADCA also has tools to help you succeed. Thanks.
Okay, thank you so much, Andrea, and to our panelists. We're going to go ahead and move into the Q&A section, but before we move into Q&A, actually, speaking of evaluation, I have dropped the evaluation link into the chat. Jessica has put the QR code up on the screen. We kindly ask that you please take a moment to fill out this evaluation. It helps us immensely with reviewing all of the things that we offer here at CADCA. And also to receive your letter of attendance, you do have to fill out the evaluation. So let's go ahead and move into our Q&A portion. The first question, and if you have any questions, please be sure to drop them into the Q&A box. The first question that we have is that Jaden mentioned they educate elementary age students in their community. Is there a specific curriculum you use, and how do you implement it in the schools?
Yes, I can answer that. So our curriculum is just in-house curriculum that we've created, we keep updated. And so right now we're not able to share that curriculum, but speaking on behalf of evaluation, we do pre and post surveys, of course, before all of our programs. And the ultimate goal is getting our curriculum to be certified as evidence-based. That way we could provide that to other organizations at a price, because we are a nonprofit organization, but that is the ultimate goal, is to get that programming evidence-based. That way we can share it with others, but right now it is in-house. And how we implement it in schools, all of our programs are 4-lesson series. And so we just work with the schools. We do have a wait list because we do cover a 7-county region. And so schools reach out to us and let us know what grades they want us to cover, what programs they would like. And then we have schedulers that just work with the school counselors or administration on how, scheduling that, what the dates are and times and things like that. Yeah.
Thank you. And then do you have any tips on how to host a data walk, or some things to keep in mind when planning for one?
So I can start here, but I would definitely be interested in other panelists weighing in from their perspectives. So one of the challenges is that a lot of times you have a ton of data. And so one of the things you have to do is figure out what you don't have a week to have everybody process it all together. So you're going to need to decide what are the key things we're going to pull out. And so you're keeping in mind the goals of the evaluation, the goals of the group. You're communicating with the group about what is going to be most important to them. And so you're using some of those processes to help drive what you're going to pull out, because you can, in ours, I think we pull out really just a handful of data points to consider, and it takes a whole hour to discuss. So that is one thing to keep in mind, is you don't want to show up with like 100 pieces of data to sift through. You want to be targeted in what you're going to identify. Also keep in mind that people communicate in different ways, and there are ways to incorporate that. And so that's where it's nice to have ways for people to write as well as talk. Or draw, or having different ways for people to engage with the material, for people who engage differently. And then also really consider who is the right person to facilitate the conversation. Sometimes that's the evaluator, and sometimes that's not. So thinking about like who is the person that's going to facilitate follow-up conversation from here. And then if anybody else has things to add.
I know not everyone has access to this, but they were able to make us like these big, nice poster board size banners that had the information on it that we were then able to keep afterward. So I thought that was really helpful, that it wasn't just like a piece of paper or a line on the agenda that we would chat about it a little bit. It was an actual activity that got us up and moving around the room, get our creative juices flowing, and that we were able to be in kind of a small group and have that conversation. So I thought that was really helpful.
And I'll jump off of what they both just said. One of the things that I took away from it was that as the coalition chairperson, it did get everyone's juices flowing and there was lots of ideas happening. But finding a way to kind of like organize all those ideas to take away to move forward as a coalition was really important, because it does get a little bit like, I don't want to say chaotic, but there's a lot of ideas and we want to make sure we're using those ideas and those thoughts, those key takeaways, moving forward in the right ways. So that was important to me.
Great, thank you guys. What is a snowball sample?
I can take this one too. That's a great question. So it's a way of recruiting people into your survey where you are using people's networks to bring more people in. So say you're trying to get educators and staff at a school and you have a few champion teachers or staff that you're working with. You could ask them to talk to their friends and colleagues that they're working with to take the survey. And then maybe some of those people, they tell some of their friends and colleagues. And so the snowball analogy is like, as a snowball rolls downhill, it gets bigger because it picks up more snow. So kind of as word gets out and people are spreading this in their networks, you're able to expand your reach.
Thank you, Jessica. The next question, I'll pass this one over to Kellen. It says, can you talk more about the personal TA that CADCA provides? What do they provide TA on? How does a coalition get the personal TA? What is the cost? And is it one-off or continuous?
Yeah, thanks, Abby. Hi, everyone. My name is Kellen. I'm a senior manager in the public health program department at CADCA. And so we provide lots of different types of TA. I hate to give you sort of a broad answer, but we have the TA we provide for coalitions is around building general coalition capacity, so helping you engage stakeholders, and or around specifically implementing a strategy, maybe one you've identified in your logic model or your strategic and action plan. And we have TA that can be set up to provide one-off individual TA and or TA that can be part of a larger program. There's also TA that's integrated into our trainings and things like the NCA. So if there's specific TA that you're looking for, if there's something you want CADCA to partner with you on and provide one-off technical assistance, the best route would be to email CADCA so that we can talk more about what that would look like in terms of cost and one-off versus continuous. So I'm going to put my email in the chat, and feel free to email any questions related to TA or something you're looking for getting support on to me, and I'd be happy to talk to you one-on-one about it.
Thank you, Kellen. The next question, do you have tips on getting connected with organizations like the local PD so they want you to come in and present this data?
I think part of it is just keep showing up, keep being present, right? And I think sharing data is really important too. So having that data available to say, this is how our community has been affected. This is what we've done the survey. This is kind of the satisfaction level that your staff has reported, and explaining the why this would be beneficial to present to your staff, right? Because we don't just want to have another training to have another training, but why would this benefit your staff? I think all of those are important.
Thank you, Jaden. Next question is, please share how many Narcan vending machines you have. How did you determine how many were needed? Where are they located? And how did you select the locations?
Maddie, do you know how many total there are?
I want to say we have 5 total.
Okay. And I know that it was considered because Troy is the county seat and that's where a lot of resources are focused. But there's different, it's a very rural community, so there's different towns that are further away. And so I know they were really strategic about where they put the Narcan vending machines so that it wasn't just, you know, saturated in.
I think the ambulance district really relied on a lot of their data of where their calls, like hotspot
Yeah.
mapping was coming from. And then they strategically placed them based off of that data. They were the ones that made that decision for the because it was their funding to place them. But it was based, I think, on where the calls were coming.
Thank you, Madeline. And Jaden, can this next one I'll pass it to Andrea. Andrea, can you please provide information regarding the cost of evaluation services provided by CADCA?
Yeah, so I mean, that's a very individual question. It depends on what you're looking for an evaluator, what services we can provide. And I'd be happy to put down my email and we can have some one-on-one conversations about that and how we can help you.
Thank you, Andrea. And then what are the best questions to ask on your pre and post surveys for the events/presentations you host?
I can
So,
take this.
oh
sorry.
yes,
No,
please
Jaden,
go.
please.
Okay, I was
You
just gonna
start.
say, as far as like a presentation, we just focus on whatever information we're trying to get across. You know, did our objectives, our outcomes, were they reached? Did the members that attended that training or presentation, did they pick up on the information that was trying to be communicated? You can take the rest of this, Jessica.
I was going to say basically the same thing is, you know, what was your goal? And then ask people if you met your goal. And then think about what would you like to use? What would you like to know to plan for the future, and ask people about that so that you can use it in your planning. So so I don't know that there are best questions, but it's going to be really dependent on your goals in that event and your goals for the future.
Thank you. What kinds of questions would you ask youth to spark conversations during a data walk? Or how do you get youth excited to engage in this? We have done a data walk before, but youth seemed too shy to add their input.
So I first want to say how amazing I think it is that you're engaging youth in a data walk. That is very exciting, and can also be challenging. And I don't know what all strategies you've already tried. But some things that if you haven't tried that I would consider is, one, is it possible to bring youth in from the very beginning and have them even take an ownership role and a leadership role in working with the data or preparing for the data walk? Like youth, their skills in data analysis, poster design, all of these things are phenomenal. And so is it possible to bring them in very early in the process so that they feel like they have co-ownership of the process? That could help increase engagement. You can also think about what we discussed earlier about there are different ways people communicate. And so ensuring that you have different ways for people to respond that don't necessarily require talking, but where they could write or text or draw reactions, so that there are a variety of ways to engage with the material. Something that I do when I'm preparing to engage youth in data is to start out with like a silly and fun example to just get everybody relaxed and their blood flowing a little bit. So you can start by having them, build a little bar chart out of Post-it notes about their favorite caffeinated beverage or where they want to go on vacation this summer. And so you have them get up, you have them moving and engaging with either building data or interacting with data in a way that feels very low stakes. There's nothing really personal about it, to kind of break that ice and get them in there. And just think about, you know, what are the ways that the adults, it's really hard for us to truly give over ownership sometimes, but that can be such a great way to create meaningful relationships and meaningful opportunity for engagement.
Thank you, Jessica. That looks like that was all of our questions. So just as a reminder, you will receive a follow-up email with all of the slides, the recording, and also a PDF version of the evaluation competency page that Jessica showed, or Katie showed earlier in the presentation. Our next webinar is scheduled for June 10th, where we will be joined by Laura Brossert, and she will talk about internal communication. We do have the registration link for you here in the chat. And I just want to say thank you so much to Jessica, Jaden, Maddie, Andrea, and Katie, and Teresa for joining us today. And thank you to all of the webinar attendees for coming to the webinar today. And if you guys have any questions, please feel free to reach out to me or to any of the emails that you see here on this thank you page. I'll go ahead and drop my email in the chat. And then please, as a reminder, to fill out the evaluation to get your letter of attendance. We do need you to fill out the evaluation, and you'll receive a follow-up email with a link to that as well. Thank you again for everyone who joined.